Hello, I'm Andy Reynolds, host of NCQA's Quality Matters podcast. Today, I'm speaking with Yoona Kim, who is CEO of Arine. Arine is a thought leadership sponsor of NCQA's 2025 Health Innovation Summit. To learn about Arine's work and what they do to improve healthcare, Yoona has agreed to speak with me. Yoona, welcome. Thank you for your time.
Thank you for having me, Andy.
I'm curious about your work, your impact, and what you see coming in the field of healthcare quality and improvement. So I'll ask you three questions: what, so what, and now what? So let's start at the beginning, the what. What does Arene do to improve healthcare in the United States?
Arine is a medication AI company whose mission is to ensure safe and effective medication therapy. The reason why we are focused on solving this problem is because it's the largest area of waste in our healthcare system. One in every six healthcare dollars are spent unnecessarily on the problems that medications can cause when they're not used safely. In addition to that, it's the third leading cause of death in our country as well, next to cardiovascular disease and cancer. So it is one of the largest problems to solve in our healthcare system. And we are doing this through the use of AI, combining AI with clinical expertise to get the medications right. So we built a medication AI platform that takes in all available data from our enterprise customers, which are health plans and risk-bearing providers, and we turn that data into actionable recommendations around who needs a medication change and what should that right drug and dose be in order to both improve quality of care as well as reduce cost of care.
I'm intrigued by a couple of things you said there. One in six healthcare dollars is wasted on poor adherence to drug treatment. Did I hear you right?
It's not just poor adherence, it's actually a combination of factors. So sometimes it's adherence, sometimes it's the wrong drug choice, sometimes there's deprescribing that needs to happen, especially in the elderly population that are often on drugs where the risk benefit profile no longer makes sense at that age and could cause risk of falling and other consequences. And other times it could be there's conditions that need to be treated with medications and are yet untreated.
Wow. Wow. And you say number three cause of death.
That's right. Right. So the amount of money we spend on medications as a nation, which is around $530 billion annually, is the amount of money we spend on the problems that they cause. So imagine if we can just get everyone on the safest and most effective medications, then we can save over $500 billion annually.
Wow. Wow. Half a trillion, if my math is right, off the top of
Yes,
my head.
that's right.
Well, that is a big what. Let's move on to the so what. I'd like to hear about your impact. How do you know that you're improving care?
Yeah, so we've been able to improve care for all stakeholders in the system. So for patients, we remove those dangerous consequences of being on the wrong medications, and we can materially improve their outcomes. Some evidence of that is we can reduce hospitalizations by 40% and emergency department visits by over 20%. Then for the providers, we are really helping them with the right information. Oftentimes, they don't have the time or the data to make the right medication decisions. But with the help of AI, we can bring all these data pieces together, which medications have been tried and failed in the past. What are the other comorbid conditions? What are the social behavioral factors for those patients in order to surface very targeted interventions for the providers that save them time and lead to more effective treatment decisions. And then for our end customers, which are the payers, we ultimately, by improving patient outcomes and reducing unnecessary consequences of dangerous medication use, we are reducing total cost of care by 10 to 15%.
Wow. Impressive results.
There's a big so
We've
what.
right, a big so what, exactly.
Yeah.
Well, we've covered the what, the so what. I'd like to look ahead. Now what? What do you recommend people who care about these issues know or do now? Or what should they expect in the future with regard to the kind of solutions you're offering?
So I think it's key to remember how medications can affect the continuum of care. So not just look at medications in silo, but to look at the total cost of care picture, which is what we do at Arene by getting the medications right, we can reduce medical spend. So looking at that picture holistically. We do the same thing with patient care through the use of AI. We're looking at their social, behavioral, and clinical factors to, again, get very targeted and personalized recommendations to both the patients and the providers in order to move the needle on both clinical and economic outcomes. And the now what for a company like Arine is that there are a lot more AI tools available now with Gen AI. So we are actually further personalizing care through the use of Gen AI. We are bringing in unstructured data elements into our recommendations, things like patient sentiment and engagement. We're understanding from those conversations to then, again, further personalize the recommendations and really meet patients where they are with our interventions.
I note that you are a co-founder of Arine, and your company is coming up on, I believe, its eighth birthday. 8 years is a long time, or an eternity, in the world of AI. So I'm curious, how has your thinking changed? Or if you think back 7, 8 years ago, where is the field now compared to where it was when you started Arine?
So we've always been an AI company since 2017, but in the early days, our AI was using tools like machine learning, which are very effective tools we still use today to proactively predict who needs an intervention. But now what we are able to fold in are, again, further personalization through the use of Gen AI. Now, I will say it's important with Gen AI. Everyone talks about Gen AI in terms of efficiency that can be gained through use of Gen AI. But it's really important. We always say this at Arine. It's not about what AI tools do. It's about the patient outcomes that we can improve with Gen AI. So we always have an eye out on how we use AI to allow patients to live their healthiest lives.
And looking back over the almost 8 years of Arene, what do you know now that you wish you had known 8 years ago, 4 years ago, or maybe even 2 years ago? I'm curious about how your own thinking has evolved over those 8 years.
So we've always been an outcomes focused company, but I would say what has surprised me over the years, I mean, in general, healthcare enterprise customers have been slow to adopt technologies. That being said, when you can show and demonstrate tangible outcomes in terms of these clinical and economic outcomes, their adoption is actually much faster than we even expected. And even when you look at the industry at large, healthcare as an industry is adopting the new Gen AI tools at double the rate of other industries as well. So again, it's really focusing on the outcomes, and when you do, there's a speed to adoption that is surprisingly fast.
You mentioned the surprisingly fast adoption. I'm curious, what are other major lessons that you've learned? What stands out for you in these dynamic years you've been doing this?
Yeah, it's important to keep mission focused. I think that's the other lesson that I've learned throughout the years, and that's critical to our company. Again, it's how do we improve quality, reduce cost of care, improve patient outcomes, and that's been our core. So as a company, we share patient stories in every single all hands that we have on a monthly basis. We hire folks who actually have that mission mindedness and really resonate with the mission of safe and effective medication therapy. So you need folks on board. Now we're a company of 300 people when we used to be just a few, and you need all 300 to really believe and resonate with the mission.
Since 8 years is such a long time in your industry, I imagine that you've seen a lot of things come and go, and you've seen, I'm sure, encouraging developments and things that have been perhaps discouraging. So I wonder, what are you worried about these days, or what keeps you up at night, given how long you've been doing what you're doing and where you see the industry going? What worries you these days?
There's a lot of excitement in the industry, but the one worry would be that the adoption of Gen AI is faster than the appropriate guardrails have to be put in place, especially when it comes to doing clinical interventions with patients. So we need to always be at the edge of innovation, but it's also important to know that these tools are new, and there's a lot of hype around them. So the way that we handle that at Arine is, again, always measuring the outcomes of what we're trying to achieve and making sure that regardless of what tools we use, whether it's Gen AI or machine learning or other types of AI tools, we're actually seeing material improvements in patient outcomes.
I don't mean to steer the conversation in an entirely negative direction. I asked you about what worries you. Let's turn that around. What are you excited about these days, or what are you eager to get to when you wake up in the morning?
Yeah, well, I am excited about the future. There's a ton of innovation happening. And despite the fact that there's a lot of challenges in the industry, affordability challenges, access challenges, you see so many companies like ourselves taking new and innovative approaches with the AI tools that are available now. And like I said, healthcare is adopting AI at double the rate of other industries, which shows that we are, as an industry as a whole, ready for innovation, ready to do things and look at things differently.
Does that adoption rate surprise you? You've mentioned that a couple of times. Does it stick out in your mind because you had expected something different?
It only sticks out because as traditionally speaking, healthcare industry has been behind other industries in the past. But that's what excites me, is that we are catching up. Yeah.
Well, a lot of people who follow our podcast and tune in to discussions like this are curious about the future. They are eager to learn. And so I wonder, where is your curiosity, or what are you wondering about most these days?
I wonder how far we can go. I wonder whether, if everyone has a AI companion to teach them how to manage their health on a daily basis. What does that mean for the future of healthcare and how much we can improve healthcare for the individuals out there?
And to answer that question or satisfy your curiosity, how do you learn, or what can you tell me about how a CEO of a AI native company, how do you keep up with these topics?
Yeah,
What's your information diet, Yoona?
with the help of good advisors in the industry, learning from other industries as well, and taking those learnings and applying it to AI, and having an excellent team on board. So at Arine, we have a data science team who focuses on machine learning, deep learning, and building those predictive models. And then we have a Gen AI team where that's their expertise, and they focus on automating, low complexity tasks so clinicians can really focus on spending time working at the top of their license with patients, as well as, again, taking in all that data and further personalizing the recommendations that we are sending to patients and providers.
You mentioned learning from other industries. Can you give me an example, or what's something that you have noticed outside of healthcare that has been useful in your work?
There's a lot of native AI companies outside of healthcare, and seeing the way that even they are transforming their own internal development processes to all agentic coding type of processes. Again, you could build faster with less resources. And there's some in healthcare as well. So again, learning from these companies who are new and they came up and about through the Gen AI era. We've been doing AI since 2017, but AI has changed throughout the years. So learning from the companies that are just building now with these new tools that are available.
Well, it's an exciting time to be in a crucial industry. So congratulations on your success. Thank you for what you're doing to support healthcare quality improvement. And thanks for speaking with me today.
Thank you. Thank you so much for having me.